Well, welcome to our webinar in our Global Security webinar series. Today, we are talking about the social dimension of global security. Thank you so much for joining us all. My name is Annette Idler. I'm the director of the Global Security Program at Pembroke College and also faculty member at the Blavatnik School of Government at the University of Oxford. First of all, I would like to thank the institutions and people who have made this possible, really, which is, first of all, the DT Institute that provides generous support for the series. I also would like to thank the Blavatnik School of Government and Pembroke College, and also the Minerva Research Initiative. And then, of course, I also would like to thank my team, and especially Frederick, who has coordinated all of that behind the scenes. Today is the sixth webinar in our series on global security. We had the first 4 sessions last term in Oxford called the Hillary term. And now we have another 4. So we had one last week and this week, every Wednesday in the first half of this term, Trinity term in Oxford. As I explained in the previous sessions, the purpose of this webinar series is to explore the meaning and the practice of global security. And that forms part of our research program on global security here at Oxford, in which we study how global security emerges from the dynamic interactions of 3 dimensions. So we look, first of all, at the political dimension. And by that, I mean global order and geostrategic power and what happens when there are shifts in global order. Then secondly, the economic dimension. And here we look particularly at the networks of transnational supply chains, and that can be both licit or illicit supply chains. And then finally, the social dimension, which is where we look at really what are the experiences of stability or instability of people on the ground, especially in contested spaces. But of course, there's much more to these dimensions, and we are thrilled that we have this webinar series to explore them from different angles, from different perspectives, and also bringing in different interdisciplinary backgrounds. And that's so rich, or makes it so rich in terms of the discussions that we're having. So we started the series initially by looking at what we actually mean by global security. What does the term mean? Is it just an umbrella term? Is that concept even useful or helpful? How does it differ from other concepts that refer to security? And then we looked at different methodologies and epistemologies that can help us understand it. So that includes, of course, quantitative and qualitative methods, but also more broadly, how can even other approaches like visual thinking come in, or the arts, the humanities. And then we also looked at various scales and spaces from the local over the transnational to the global that are all relevant for global security. Now, in the last session last week, we zoomed in on how we can think about economics. How is the economy, especially the global economy, important? And as I said today, we focus on the social aspects. As I said before, we emphasized transnational supply chains. So this is what we've done last week in order to really capture the transnational element, but basically the way in which countries have to work together to establish or maintain global security. And I'd just like to share 3 main key takeaway points that we had in last week's session. So one of them was, when we think about the economic dimension, is that, of course, the private sector is a crucial actor here. And we talked about the private sector as an intermediary, both for illicit and licit flows. And of course, that's an issue that is important to address, because we don't want to get these illicit flows to just be unchecked. Another key takeaway point referred also to states. We talked about the role of corruption and how that can actually erode security, especially when it comes to financing, for example. And then we also talked about how geopolitical considerations are linked to the economy. We talked about the example of nuclear weapons that show how states also leverage economic factors to achieve security. For example, they might spend large amounts of money on nuclear technology, but also how states are using, for example, sanctions on nuclear-seeking states, which can then change the dynamics. Today, we will have a more grounded view, and I'm also delighted to see that we have so many different kind of backgrounds coming in, perspectives from different angles and expertises. And I hope that this will help us then for next week, where we're going to talk about the interactions of the three dimensions. So we basically bring together, we synthesize the discussions from the previous weeks with this one to see how we can think about the social, the political, and the economic dimension together. And then in the final week, we'll have a closing roundtable where we discuss the future of global security. Let me now also just quickly turn to the audience, because we've prepared a quick poll to see how the audience thinks about that. So if you could just, switch on. So here it is. So those who are listening in or watching us, could you just please tick whatever you agree with most? So the question we have is, threats to global security are primarily the product of political interests by states, economic interests by private actors, the failure of governments to address people's grievances, the failure of the international order and international institutions to address key challenges, or a combinations of the above. So while we're waiting for the results to come in, I can't quite see them yet, but hopefully we can come back to that later. I just turned to our panelists and would like to introduce them as well here. So I'm delighted to have Amesh Adalja with me. I hope I pronounce it correctly. Please state your name again if I didn't. He's a senior scholar at the Johns Hopkins Center for Health Security, an adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health, and an affiliate of the Johns Hopkins Center for Global Health. And his work is focused on emerging infectious diseases, pandemic preparedness, and biosecurity. He has played a very important role during the COVID-19 pandemic. He has served as a member of the National Collegiate Athletic Association, Coronavirus Advisory Group. He's been a consultant to various businesses, schools, and organizations. He's also been an informal advisor to the International Monetary Fund. And he also has testified before the US House Foreign Affairs Committee and the Pennsylvania House Health Committee. So thank you so much for joining us today, Amesh.
Thanks for having me.
Thank you. I also would like to welcome Professor Nayef Al-Rodhan, who is a philosopher, neuroscientist, and geostrategist. He's an honorary fellow at St. Antony's College here at Oxford University. He's also the head of the Geneva Center for Security Policies, Geopolitics, and Global Futures program in Switzerland. And he is senior research fellow at the Institute of Philosophy, the School of Advanced Study at the University of London in the UK as well. He's a member of the Global Future Council on the Future of Complex Risks at the World Economic Forum, and also a fellow of the Royal Society of Arts. In 2014, he was voted as one of the top 30 most influential neuroscientists in the world. In 2017, he was named amongst the top 100 geostrategists in the world. And in 2022, he was named as one of the top 50 influential researchers whose work could shape the 21st century politics and policy. So thank you so much for joining us, Nayef. I'm delighted to have you with us.
Thank you.
And then, last but not least, I'm delighted to introduce also Francesca Soliman. She's a lecturer in criminology at Edinburgh Napier University. Her research examines the social harms linked to processes of borderization, that is the performance and enforcement of international borders, with a particular focus on its impact on border communities. And in her work, she seeks to further develop the emergent discipline of what's called semiology as a tool to analyze the wider impact of border policies, but also to advance critical approaches towards the state's roles in constructing and addressing social problems more general. Welcome also to the panel, Francesca.
Many thanks for having me.
Well, so as you can see, we have quite a diverse membership of our panel here. I'm trying to see if we can get the results of the poll. Yes, here they are. So let's see. Many people think that political interests of states are actually quite important. Economic interests don't seem to attract much attention. The failure of governments to address grievances also doesn't seem to attract attention, but the failure of the international order and international institutions to address key challenges seems to be more relevant to our audience members, and particularly a combination of the above options. So I'll be curious to see if in our discussions we get back to that, and perhaps also come to this point about people's grievances, which of course could be included then in the combination of the options. So thanks so much to everyone in the audience also for your thoughts here. Right, let me now turn to our panelists. I would like to start with Amesh and ask you, please, drawing on your huge expertise in the field, could you just tell us a little bit on what you think, what role public health plays for global security?
I think this is an easier thing to answer now after COVID-19, because most people have seen how the cascading impacts of this pandemic did affect global security. And in your introduction, you talked about three factors. You talked about the natural order, the economic issues. All of that is what happens when you see public health go awry, when there's a public health threat, like a pandemic, like an emerging infectious disease. It doesn't even have to rise to the level of the pandemic. And that really disrupts the entire way that the world works. And certain players become more important or less important. Economics gets stressed. The general population and the social cohesion in that population can also be challenged. And this is not something new, not something that just happened with COVID-19. If you go back to even the Black Death in the 13th century, those types of stressors were occurring in Europe at that time. And then you can kind of couple that with the threat of biological weapons use. And that's another area that's directly influenced with security. What happened with the former Soviet Union's biological weapons program, North Korea's moves towards a biological weapons program. So in many ways, it is integrated, because when you talk about the term or concept of security, that's going to include people's health security, as well as their economic security, their physical security. All of that plays a role. So I think it's not something that should be a stretch now for people to see. And I think COVID gives people that lens that maybe they didn't have, because the 2009 H1N1 pandemic wasn't very severe, wasn't very disruptive. But now I think nobody can really underestimate the power of an infectious disease threat to alter society and create problems for people that are in the traditional security space.
Thank you so much. Thanks, Amesh. You mentioned among the many factors that we see now, how social cohesion is disrupted and how it affects people on the ground. So I'd like to turn with that point to Nayef, and talking about how people are affected. From your perspective, what can we learn from a neuroscientific approach about the lived experience of individuals in global security, including during basically, phases like what we've seen with the recent COVID-19 pandemic?
Thank you, Annette. I have a lot to say, but I'll start off with something very brief, and then we can go back to maybe the nuances. It's critical to remember at the outset that the human condition is resilient. It is also fragile, but also malleable. So it's important to put them all together. I have theorized previously that humanity, the human beings, are what I call emotional, amoral egoists, and that our moral compass is governed primarily by our perceived emotional self-interest. And it turns out fear is central to everything we do because of, from a biological survival standpoint. We also have specific motivations that span across cultures and epochs. And cultures and subcultures happen to be highly emotive ideas, and I think we ignore them at our own peril. So the individual is central to a sustainable national and global security. And to ignore that, I think, is short-sighted and counterproductive.
Thank you so much. Thanks. You talked about the individuals and how we need to think about individuals, not just groups, I guess, or masses or the society. I think that actually leads quite nicely to Francesca's work as well, where you work on different lived experiences of individuals, particularly, right, and their identities and how they matter for global security. But you come in from a very different perspective, but based in criminology. Could you share us your take on the topic?
Yes, absolutely. So my perspective, because of the nature of my work, is very localized, I guess. So, and I mostly focus on border islands. So in some ways, I'm wary of generalizing too much what we call micro level effects. But I'm already seeing, that these are actually wider themes. I'll just summarize in 5 key points so that I don't clog the discussion. What I have found, pardon me, from visiting highly securitized spaces, I found the increased senses of insecurity, often linked to the presence of agents of the state that are meant to securitize these places. I found increased examples of social conflict and an erosion of social cohesion. I found great strong economic impacts. I'm talking about small communities that see an influx, let's say, of state and supranational agents sometimes to address issues that are perceived as outside, issues that are global, supranational, international, that are not perceived to be in the best interest of the community. Something that's not often talked about is the environmental impact that this can have, especially on small communities. There is a good body of literature, I believe, also on the environmental impact of militarization in general, and I think there's increasing attention when it comes to the securitization of borders as well. And finally, the impact of the increased attention that securitization brings, especially when it comes, I look at borderized spaces, especially in the context of international migration, and my research was mostly in the Mediterranean. So you can imagine the high salience of migration-related news, bringing hordes of journalists, researchers, and form the local perspective, bringing outsiders' problems into the community. And this goes to exacerbate all the other issues I mentioned before.
Thank you so much. Thanks, Francesca. Now we've kind of moved to the very micro level, right, to understand what happens with individuals. You mentioned the kind of increased sense of insecurity. I want to now just take us back to the kind of macro level and go back perhaps to one of the points that Amesh was making about the threat of biological weapons. So I wonder, when we talk about kind of the social relevance or how people experience insecurity, that was quite clear during the pandemic. But of course, as you pointed out, when it comes to public health, we do need to think about this larger threat as well. You mentioned the role that the Soviet Union or North Korea have played here in terms of how that increases also threat perceptions. Amesh, could you say a little bit more about how we can connect that with lived experiences on the ground? Is this something where people just have nothing to say, can nothing do about, and it's completely disconnected? Or would you say that bringing in threats like biological weapons into kind of the awareness of the public can be done in a way that is also productive?
I think it can be, because there's a lot of synergy between being resilient to biological weapons and being resilient to ordinary infectious diseases. There's crossover. It's kind of what we would call in the United States an all hazards approach. So if your community is very resilient against influenza, it's likely to be resilient against plague. Or if you have a public health infrastructure that can rapidly diagnose, detect, and respond to any infectious disease threat, whether it's intentional or whether it's natural, you're going to be in a better position and people are going to feel more secure. Obviously, there are some caveats and exceptions when it comes to biological weapons, because just the fact that they would be being used would be in itself psychologically traumatizing and disruptive, because people have not been around that. There's not really been large-scale biological weapons attacks ever. We had the anthrax attacks in 2001 in the United States, and that was disruptive, and people were scared in a way that they weren't necessarily, in a different way than they were scared from what had just happened with the World Trade Center. So there are some nuances there, but I think that's the best way to think about it. And what you have to do is realize that when you're talking about your response mechanism, or you're talking about your resiliency mechanism in a society, it's going to be your hospitals, your healthcare facilities, and your public health systems that have to be up to par the same way the military or the intelligence community is for a traditional security threat. And maybe there is some synergy that you could get from chemical weapons attacks that have been used in places like Syria, for example, where the population understands that. And lastly, I would just say, I grew up in the United States in the 1980s, and that was still during the Cold War. And as a child, you were taught how to prepare for a nuclear attack in terms of duck and cover, get under your desk. And our schools had bomb shelters built into them. And maybe you don't need all of that, but you need to understand that there was that type of mindset about the public feeling that they were empowered, that they had things to do, that they weren't completely helpless when something like this would occur. But in general, I think it has to kind of be integrated into the way we respond to other infectious disease threats.
Right. Thanks so much. So yes, basically we need to think about how we can prepare, right? How we can mitigate the risks. That brings me back to one of the points that Nayef was making about human beings being, well, moral beings, obviously, right? But that also fear is central to what we're doing. So I'm wondering, could you tell us more about how we should think about fear in those different contexts? Because of course, it's quite easy to understand if we think about war zones, if we think about individuals who live embedded in violence, basically also context of criminal violence, that is the lived experience of instability, or the migrants that Francesca was pointing to that really live these immediate risks. But then there's another fear, which is the fear of, an attack, for example, through biological weapons. What is your take on how we can kind of reconcile those different parts of fear, but also how can we avoid that there's just a constant fear and perhaps also a panic that is not really productive in terms of ensuring global security?
Just to mention that my view of human beings is that they're amoral. So we're not necessarily moral, but we're not necessarily immoral. And that's why our moral compass along a Gaussian curve can oscillate according to what I mentioned, our perceived emotional self-interest. And the prefix of perception is critical because we can misperceive or we can perceive incorrectly and go into a cascade of emotional repertoire that can be very counterproductive to our own well-being, never mind societal frameworks. So that's one. Secondly, fear, of course, is central to our existence. It's an old evolutionary paradigm that is good, but sometimes can be bad. And it turns out that if we're afraid, if we're insecure, then we become aggressive. So I have framed in one of my writings what I had called fear-induced preemptive aggression. So aggression often isn't the result of callous overreach, although it can be, but it's often about insecurity. And the way the human mind works, of course, fear is primarily in the old part of the brain, the amygdala and the hippocampus, but now we have new evidence that it's actually throughout the brain. Every bit of the brain is involved in this kind of emotion. And as I mentioned earlier, we're emotional beings. We're far more emotional than rational. And often, going back to Platonic Kantian views that rationality was tied to morality. That's not true. We have plenty of evidence to say that emotionality and rationality are part and parcel of the same thing. And it turns out actually we cannot make rational decisions without some emotional input. So that old dichotomy is incorrect. The way to, but going back to how the brain functions in our what we call the mesolimbic system, which is a series of subcortical structures that are we call the reward center. So it turns out human beings will do many things once, but may only repeat a behavior that gratifies them in some way, whether that can be constructive or destructive. And the brain can't tell the difference once you get that gratification. And it's really upon society, societal frameworks, parenting, schooling, the entertainment industry, the gaming industry, is to tie gratification with constructive behavior. Because the brain is oblivious to the difference after a few tries of whatever makes us feel good or relevant. I'll stop here.
Thank you so much. Thanks. Really fascinating to hear more on that. Francesca, would you like to pick up on that and tell us how you saw kind of the fear playing out in your research?
Yes, I was thinking as Dr. Adalja was speaking, in my view, the fear is it's such a complex. there are multiple threats that I think often get blended into one as far as individuals are concerned. So when I think of border islands, they are areas where there are kind of security nodes in the Mediterranean, for example. So you have, yes, migration. There's also illicit global supply networks. There is also demilitarization that comes with being like NATO listening spots. So when, as far as the community is concerned, they do not always know why, for example, the military is there. They might be there because they are operating machinery to radar to detect threats that have nothing to do with migration, for example, but they will perceive it as something to protect from migrants. When the COVID pandemic started, then there was an additional fear, additional threat that got again mixed in with all the others. And now suddenly there was this new fear of migrants bringing COVID to the local population. So I think a challenge that exists at the local level is especially with communities that live with fear of different threats over a long period of time, but often overlap and get muddled together. And then an additional one comes along on top. How do you ensure that this is constructive rather than just basically compounding the population's fear? And I think for some communities, this is a lot more challenging than for others.
Thanks. I guess another point here to add is how normalization comes in, right? Because in many contexts, when people live in fear or live in violent contexts, in insecure settings for a very long time, they then, of course, also start to normalize that situation. And only when they leave the context and come back in, it plays out very differently. I mean, something that I also saw myself in my own field work. I wanted to make sure that, you can also just react to each other. So do you have, among the panelists, do you have any questions, reactions to what people have said?
I would just add that just regarding the borders, we've seen that really play out with COVID-19, even in places like the United States, where under the Trump administration and then continued to the Biden administration, there was a program called Title 42, which did not allow Southern migrants into the United States because of a public health threat. And we've seen that type of fear of COVID coming from the southern part of North America be kind of weaponized or used as a way for an immigration policy, or as a way to push an immigration policy with kind of a pretext that this is for COVID-19 and how disruptive that can be. And so I think that when it comes to border communities, infectious diseases and infectious disease emergencies have always played a major role there, because there is that fear of the other that can then be conveyed to fear of what diseases the other may be bringing. And there are some historical precedents for that. But one of the first things you see during an infectious disease emergency, even though it doesn't work, even though we all recommend against it, is border control issues being put in, because it's seen as politically expedient. It's seen as something that makes the world leader look like they're doing something, even if it's the exact opposite of what you need them to do. And it happened in the United States during the Trump administration, and then it also happened during the Biden administration. If you can remember, during the very first days of Omicron, there was a travel ban in the United States on some of those Southern African countries, even though we all said Omicron is already here, the Omicron variant of COVID. But yet the president felt compelled to do that, not because of science. He wasn't answering to science. He was answering to politics. And that's one area where infectious disease, our resiliency could really use improvement, is to get the politicians away from kind of pulling the trigger on things that don't work from a scientific medical perspective, but really do work if your goal is to remain in power and to placate kind of the masses.
Right. So that goes directly comes back to the kind of political interest, right? And how they are just using that. I mean, we've seen that also, similar case at the border between Colombia and Venezuela. The border was closed. And again, the reason was COVID-19, but that then actually increased insecurity for many of these communities, for many migrants, Venezuelans who tried to flee and could not leave. So it has all these other repercussions as well, in addition to not stopping the infectious diseases. Any other kind of comments, reactions from Francesca?
If I may add on this point, it has been noticed quite considering that in the last, I guess, decade or so, this intertwining of migration powers with public health, and this expanding of powers for executive usually, but also other administrative agents to basically implement very coercive or quite coercive policies in the name of public health. And we never really fully understood what that meant and the extent to which these powers could go until the COVID-19 pandemic. Pardon.
Thank you so much. Thanks. Nayef?
Yes, can I follow up on both points? I think Amesh makes a really interesting point, an important one. And it's really the nexus between electioneering and the short-termism that politicians have to deal with. I mean, I will not be critical of that, against even the national interest, as he alluded to. Sometimes they have to answer to sections of their constituencies that sometimes is counterproductive. And human beings, whether they're within the borders or elsewhere, don't do well if they feel alienated, if they feel disregarded. And I've often written on dignity, and dignity to me is much more than the absence of humiliation, but it's the presence of recognition. So we need to acknowledge people, no matter how distant or different or even apparently dysfunctional, because to get them to be cooperative within the national context or even within the global context in terms of global security, people have to feel included and respected, and this muddling up because of electioneering cycles and sound bites can be very destructive.
Thank you so much. Thanks. I'd like to now turn to the questions that I'm receiving here from the audience. And for those of you out there, you can also use the Q&A function. So I have one question here that is for Amesh, but I think we can also just expand it to everyone. So that here, someone asks, what is the role of international cooperation in building the global public health infrastructure that you argue is necessary for resilient societies? And perhaps to expand that a little bit is, what can actually governments do? Something we talk about a lot at the School of Government, obviously. When we talk about these very localized effects, the fear, the sense of insecurity by communities, how can that even connect with the state level, with governments? Amesh, over to you.
What I would say is that an infectious disease an infectious disease emergency anywhere in the world is an emergency for the entire world, because by their very nature, many of these infectious diseases are communicable. And while the threat may be different if something is happening in sub-Saharan Africa versus something that's happening in the United States, there is going to be implications. And I think you want to have a world coordinating body, something like a WHO that was actually much more operational, to be able to get resources where they need to be to stop these things from becoming disruptive, economically harmful, society crushing events. You can do that. And that's what I think needs to happen. And it's not that this is anything that's difficult to understand. Anybody in the field of infectious disease knows that these types of things spread. You can even look at monkeypox. A lot of us in the field have been talking about monkeypox since at least the mid-2000s, saying if you don't actually control it at its source in places like Nigeria, in West Africa, you're going to end up having cases spill into Western countries, and then it's going to become more disruptive. So it's not as if this is rocket science or takes anything hard. It's just about being proactive. But as we just heard, people have this kind of short-termism. They're not proactive. They're very reactive. And that's what ends up happening. So it's not that this is the same thing as the coordination we need for nuclear weapons or whatever it may be. This is much easier to do, but yet is just not done because it's not prioritized. And I think the short-termism is really something that we have to try and combat. And it's strange that the short-termism still persists even after COVID-19.
Thanks. So basically, we need more long-term thinking, more planning, and also, make sure it's clear where priorities should lie. Nayef, that brings me to you, perhaps with your geostrategist hat on, where you combine, of course, also that work with your other work. Could you tell us a little bit more about how you think we can get states, governments to think more about these implications?
It's really difficult on two levels. One, the national interest drives all state action, number one. Number two, the state happens to be the most consequential unitary act in the global system because it enforces law, it makes laws, enforces laws, gets into treaties with other states. There is an ongoing nightmare for people in geopolitics, where it's obvious the geopolitical path of reconciliation is much more positively consequential for all concerned, and yet in the spirit of zero-sum paradigms, nothing happens. And I've also written before that in a hyper-connected and deeply interdependent world, zero-sum paradigms don't work. And I had suggested what I had called multi-sum security, and a symbiotic realist framework, where win-win solutions are preferred. You can have competition, which is central to a non-governable global system, but it doesn't have to be conflictual competition. You can have non-conflictual competition, and you have to be able to allow what we call absolute gains rather than relative gains. In outer space, I do a lot of geopolitical analysis in outer space, and outer space is a global commons. It belongs to everyone. And it's not like a piece of geography in the middle of some ocean, which you can protect and isolate and like low Earth orbit, which is about 250 kilometers above Earth, belongs to everyone, and it's deeply cluttered. And we don't even have what we call space traffic coordination. And there've been attempts here in Geneva, the Conference of Disarmament, but also in Vienna and in New York, which I participated in many times, trying to get some sort of a code of conduct, some sort of understanding, and it's nobody. I wouldn't say nobody, but there's the big players are not interested in sitting down. And it's often, for example, the space traffic coordination. To be able, it's like if you're driving downtown in Oxford, without traffic lights, it's going to be a total mess. And in space, it's not quite a mess yet, but it will be. And the reason they don't cooperate is because they have to declare their assets, what they are, where they are in orbit. And they don't want to do that. So they'd rather have this kind of ambivalence in order to protect the national secrets, the national interest secrets, versus the common good, which in space, like in other communal ideas in the world, is going to be, no one is going to be out of danger in that regard. So it's really a dichotomy between the national interest and the global/planetary interest that is very disruptive to geopolitical analysis. And there's really not much that has changed in that regard, and I don't foresee that changing in the near future.
Thanks. This was a rather pessimistic assessment. Let's see if maybe Francesca can give us a more optimistic view on how that plays out with regard to migration policy, for example. I'm doubtful.
Yeah, sorry, no, I have no optimism to offer. I quite agree with Professor Al-Rodhan there about the state governments. National interest will always be prioritized, even when it doesn't even seem to be. It seems patently contradictory. One does, for example, the failure to organize for a pandemic that experts have seen coming for quite some time. But I would like to add, on a local level, so we talk about state and governments. When we zoom into the local level, the state is not sometimes the all-powerful actor that we think it is. In the places I've seen, the state was often described as absent. What actually happens on a local level is regulated by local actors, local governments, and more often than not, I will link in those powerful economic private interests that were overlooked earlier. When the state is in crisis or perpetuates a state of crisis, as so often happens in border areas, then local actors will take power and will take control. And there is an interest in perpetuating this crisis, perpetuating this insecurity, because there is always someone who profits from that. And especially when these interests are economic interests, especially at a local level, there are issues like corruption and collusion sometimes come in. So yes, I'm afraid my view is possibly even more pessimistic than what Professor Al-Rodhan was offering. There is not only a lack of willingness by states to actually address these insecurities of them. But I think there is the emperor is naked. There is insufficient ability and capability and power often, and that I think goes some way to explaining some of this inaction that often puzzles the rest of us.
Annette, can I add a little? I completely agree with what Francesca had said. It's spot on. Let me add just a couple of points. International relations theory, as you know, presupposes the rationality of the state. And most states are rational most of the time, but not always. States can be emotional. And that emotionality, and I've written a lot on that, it comes from what we call strategic culture, a concept that was developed at Harvard in the 1960s, 70s because of the Cold War, which originated in what's called the National Character Studies, which was in the US in the 1940s during World War II, but also what's called applied history, and often a skewed view of your own history, and more dangerously, a skewed view of someone else's history to justify antagonism and a pecking order in terms of civilizational ranking. There's also the economic factor, which Francesca brilliantly alluded to. Most conflict in geopolitical terms is reducible to economic interest. I mean, there are all kinds of ideological, political, historical, but at the end of the day, it's really economic competition. And you see that in the current crisis. You will see it, hopefully not, in pending crises, which inevitably will come. And there's no solution for that. Without an overarching global authority that arbitrates, the UN is a dysfunctional entity. It does its best, but it's going nowhere, especially with the veto system. But it cannot enforce. It may arbitrate, but it cannot enforce. And that's a really tall order to hope for something just, equitable, and overarching. And without that, I think these games will forever continue.
Thank you. You talked about emotions, the role of emotions. I mean, if we go back to the individual level, there's a question here that relates to that asks, what is the role of empathy in individuals' perceptions of security? And perhaps I would like to just kind of add to that, and perhaps also, well, this is a question to Nayef, but also to Amesh. Where did you see perhaps empathy also playing out in terms of communities helping each other, especially during the pandemic, but also using that empathy for better leadership? Because we've also seen in the pandemic, of course, very different responses across different governments. Is that something that we can leverage that doesn't just stay at the individual level, but actually can be used also at the level of societies? Maybe Nayef first, and then Amesh, and of course Francesca as well, if you have thoughts.
Sure. Empathy is a real paradigm, and it is in us. We are capable of empathy, and it serves us well, both in small groups and bigger groups. But there's a caveat to that only operates if we are feeling good about ourselves and our immediate milieu in terms of security, in terms of survivability. And we don't do very well when we are under threat, even emotional one, even identity issues. So empathy is wonderful, but we can't count on it when the chips are down. And thus, you need more hardcore, structural, incentive-based paradigms within a particular society to encourage people not to be afraid, to feel included, and to move to the slightly moral side of the curve. Without that, it is illogical to expect of individuals who have families or have their own view of themselves and bigger groups for them to behave correctly when they don't feel they're part of the game. So I think empathy is good. It works. It is real, but it's out of the window when things get a bit muddy.
Thanks.
Yes. So I think there's a lot of interesting things that could be said about that with infectious disease. So particularly about when the identity is questioned or someone is under threat that they're unable to be that way. And if you can think about an infectious disease in the United States or any country, if it's something that's seen as something that you're not at risk for, something that's not going to happen to you, but it's happening to some other people, whether that's tuberculosis, whether it's HIV, malaria, whatever it may be, there's going to be empathy from one group to the group that's not at risk to the group that is at risk. It seems to be that seems to be somewhat common, or that it happens, that there are charities, that there are groups that are working there. And I think that happened for some part during COVID, especially towards healthcare workers. In the beginning in New York City, people would go outside and clap and bang pots and pans for the healthcare workers. But what happened is exactly what we just heard, is that then people got threatened. Their identities got threatened. This whole COVID got sucked into identity politics. And then all of that went away to the point where the same people that used to be cheered for were then getting death threats. So it really has to do with how people are processing this. And I think if it threatens their identity, and if everything with an infectious disease emergency or a security event is seen as, one tribe thinks this, another tribe thinks that, and then it just, all of that kind of, all of the bridges between people basically disappear, and it just becomes another political issue where people are on both sides of where there's no way to broach that.
Right. So there's basically always the risk of politicization of the issue as well, and polarization obviously as well. Francesca, what would you like to add here?
I was thinking about a debate that's been going on now in Italy lately after yet another shipwreck at the border, what some have called compassion fatigue. I don't know if that's a term I enjoy particularly, but with the spectacularization, of migrants' death at the border, so we found that there was a TV program. They were going through the beach looking for items that had belonged to the people who have drowned. They removed a child's shoes so they could show them on TV to express the degree of the tragedy. And that caused a big debate, because if it hadn't been a migrant child, would there have been such a callous use of a prop shown on TV? And others arguing that, well, how are people supposed to empathize with migrants' deaths unless they feel this closeness? So this has brought over the years to this race to the bottom, where you need the migrants' death to be more and more spectacular, more and more grotesque, to be able to elicit these reactions. And that has consequences on how we see migrants. That has consequences on who then becomes deserving of this seemingly limited pot of empathy that we have to give out. So in my view, this brings to the opposite effect. It means that the group that's deserving of empathy becomes smaller and smaller. And this, I believe, has political consequences as well. Political consequences on who we decide to help, who we decide to allow in, and who is deserving not just of empathy, but of basic dignity. So, yes, and an interesting slippery slope when the chips are down.
Thanks. So what you're describing is almost like the numbness of societies, right? Because we're being exposed all the time to these pictures and through social media, the kind of the effect on that. Nayef, did you want to have 2 fingers here? Yeah.
I second what Francesca had said, and just to reemphasize that empathy doesn't work across the internet and TV screens. It works up to a point. People have more drastic things that they need to deal with: dinner, schooling, their own misery or lack thereof. So I don't think empathy is the way to go. I think we need hardcore. I mean, we welcome any trace of empathy we can find. I'm all for it, but I think that's not sustainable nor dependable. We need to find more concrete, structural frameworks across borders, within borders. That is symbiotic. That's win-win. No one is asking anyone to give up their own well-being or their own survivability or feel-good behavior towards someone else, because that's, although there's nothing wrong with that, that's kind of altruism, but it's not something we can count on. I think we we can theorize all we want unless we create structural frameworks. And those structural frameworks implicitly have to be win-win. Everybody has to, because that's the nature of humanity, is unless they get something out of it, they may empathize for a little bit and then they move on. So there has to be something so self-interest is paramount, and even in moral issues. So you have to tie that in, moral, constructive. Without that, I think we're dreaming. And I think we really need to do that. And that is almost certain to produce the result we desire, or at least most of the results we desire. Short of that, I think we're wasting our time.
Thank you so much. That actually leads quite nicely to what we've seen here now in the Q&A. Isabella Ban asked the question, to what extent do global human rights norms shape state responses to address insecurity? So when we think about structures or frameworks, would you have any thoughts on that? And while you're just thinking about your response, I'm also just going to read another longer comment here from Antonio Sampaio, who says that his impression from observing discussions on global security in think tanks and journalism is that the concept is closely tied to the interests of states, and even then the interests of wealthier, more powerful states tend to be prioritized. He thinks that if we were having this discussion about 20 years ago, unquestionably the war on terror would have been mentioned as prime example of a global security area. States tend to treat international global security issues through traditional methods such as interstate cooperation, agreements, intelligence, but at the local level, marginalized communities due to income, ethnicity, religion, tend to experience security very differently from states. Constant finding on local security perspectives relates to bad or corrupt governance by states, frustration and anger over the shortcomings of states that are exploited by armed groups to build rebel movements, exploit illicit economies, control territory. So I'd say this is another point to kind of caution or to be very cautious when it comes to state responses, because of course they don't necessarily have positive intentions. But let's go back to the question by Isabella Ban. To what extent do global human rights norms shape state responses to address insecurity? Keeping in mind, of course, that note of caution from Antonio, I would say that states do not necessarily have good intentions. Would anyone here come in who would like to go first? Nayef? Yeah.
So human rights is a sacred idea that must be preserved at all costs. However, if you observe various states' behavior towards human rights abuses, both within their own countries, even within democracy and elsewhere, it's highly selective, it's highly hypocritical, and it's often, sadly, tied to specific, what we call narrow geopolitical goals. And that's a shame because it pollutes a very sacred, important idea. Same with climate, by the way. Climate is an ultra-sacred, critical, existential threat that we all face. And yet it's weaponized and manipulated for very specific epochs of policy. And this is really sad and counterproductive. We see it every day in our geopolitical analysis, but it continues. And I honestly don't see. Again, I'm sorry to be so Debbie Downer here, but it really is difficult to underestimate how the national interest trumps everything else beyond the very narrow geopolitical goals.
Thanks. Amesh, can you give us a little bit more hope?
I think that when you think about it from my perspective in my field, what we saw, for example, in China with COVID-19, their mitigation policies, where it went from this extreme of pulling, separating children from parents, nailing people into their homes, forced quarantine camps, killing people's dogs if they didn't want to go, if they wanted to take their dog to quarantine. And I think that led to the undoing of that. That's where you saw these massive protests against the Chinese head of state, where people were calling for him to resign. And it was over the fact that these basic human rights were not being respected by the Chinese government in their quest to do COVID zero, which probably was a pretense as well. But I think that when you're talking about these responses, that as we just heard, individual rights need to be sacrosanct. and that the national interest, in my mind, from a political perspective, is to protect the individual rights of your citizens and to respect the individual rights of everybody else. And I think that's how I think public health works best, is when it's voluntary, not coercive, and you actually respect people's individual rights. A lot of the protests and acrimony we had in the United States was because people believed their individual rights were being violated, and that made the response much, much harder. So I think, while it might be expedient for a politician to say, we're not going to worry about individual rights, this is an emergency, that actually ends up in the end hurting the response and making it less effective. So I think that the core foundation has to be that respect of individual autonomy and rights.
Thank you so much. Thanks. Francesca, could you add to that also perhaps the question or a response to the question by Antonio on how the interests of local communities can be better included in those state responses? And is our human rights kind of the pathway to the solution here?
When human rights are concerned, I agree with everything that's been said so far, the positive and the negative, potentially very powerful instruments, but also in the Mediterranean Sea, we see policies such as non-assistance at sea, which is entirely designed to avoid triggering human rights obligations, even at the cost, at the obvious cost of migrants' deaths, or the externalization of border control to Libya, just so that the European Union is not responsible for protecting migrants' human rights or giving refugee protection under the Geneva Convention. So how easily we can actually circumvent these mechanisms, and if the national interest always trumps international obligations, not forget that these are the same states who actually wrote these treaties. So there's always a backdoor somewhere. When it comes to local communities, I find that it's difficult, but the empowerment of the community is the only way to go. And the empowerment of the community cannot come from above. I find that these processes that I talked about before, the negative social outcomes, they also disempower the communities. They disempower the communities by decreasing the social cohesion. They disempower them by economically affecting them. So, and all of these are processes that also silence communities, and they help with compliance. So the opposite process of that, it has to be a grassroots movement that goes from the ground up. And it's difficult because it means overcoming those divisions, the social divisions, those fears that perpetuate these divisions, and being able to break free really from this oppressive and self-perpetuating crisis-led processes that currently have these socially harmful effects.
Thank you so much. I mean, basically across your responses, what came through is this constant tension, right, between the kind of the national interest or the state's interest versus the interest of the individuals, and then of course also global society at large. I don't think we'll be able to solve this here in this webinar, even if we continued, but we're also running out of time. We only have, I think, like 1 minute left. So I'd just like to use that to ask each of you if there's any book, a publication, a podcast, any other output that you would like to recommend to our audience to better understand global security from your perspective, because we know there are students out there who are interested and others, and we are compiling a list of useful resources to consult afterwards. So would you like to just jump in? Maybe Francesca, any recommendation?
Yes, I have a book by Katia Franco to bring the criminological perspective to global security. It's called Globalization and Crime. I believe it's in its 3rd edition already, and I think it's a must read.
Perfect. Thank you so much. Thanks. Amesh? I
think it's hard to recommend just one book because there's a lot of background you have to understand about infectious disease. But one thing that's in the news lately is, with Russian aggression in Ukraine, is to think about their biological weapons program and how that shaped global health security. And there's a book called Biohazard. It came out in the late 1990s by Ken Alibek, A-L-I-B-E-K. He was one of the bioweapons engineers or biologists that worked in that program and then defected and wrote a book detailing it. I think it's important to understand that context how it shaped the way we think about infectious disease and security.
Perfect. Thank you so much. Nayef?
If I can be egoistic to live up to the paradigm I mentioned earlier, I can recommend one of my books, which just came out, called 21st Century Statecraft. And it addresses everything I said, but also geopolitical competition, human rights, global security in all of its dimensions, and how the national interest is really the fulcrum. But as a subset to that is really the human condition. The individual is really, if the individual is taken care of within states and across states, the world will be fine. If not, we'll have problems.
Right. But thank you so much. Thanks to all of you for your excellent contributions. I think this was a very, very engaging discussion. And as I mentioned before, we'll also make this available as a podcast. Please join us also next week, where we're going to discuss how political, social, and economic dimensions of global security all interact and play out across different levels, from the local over the transnational to the global level. So thank you so much. Thanks, and have a nice rest of the day.